Just let me make sure we're live on Facebook. Okay, we're live. That's, you know what? I think it's easier to go to YouTube. Anyway, let me log back on here. So, okay, everybody can unmute themselves. Wow, that was awesome. That was easy. So welcome to RenéMarie Stroke of Luck. I'm RenéMarie, and today is going to be an awesome show as always. Thank you to Ginny, who's been doing a lot of work. Ginny that's been doing a lot of work booking people. Of course, everybody knows Judy Marlowe had retired, and Ginny has taken on the job, and it really is a cumbersome job. Nobody knows that the back end of it, of operations, you have to give grace to everybody that does the work. So today is a really important day because once a year on October 29th, World Stroke Day comes upon us. And it's really important because strokes do not discriminate. They happen to anybody. It doesn't matter your age. It doesn't matter your religion. It doesn't matter your faith. It doesn't matter your country. It doesn't matter who you are or what you are. It comes upon you, and it really does sometimes, or most of the time, shock a family. And it does affect the whole family. It doesn't only affect the person that suffers the stroke. I, at this point in my life, always like to consider it a stroke experience because I was fortunate enough to be able to come back and be the voice for stroke patients. And Nicole, who is on the show as well, she has an extraordinary story, and she has been blessed enough to come back and also be the voice of stroke patients and advocacy. We're going to let her share her story once again because she was on our show. She's a family member now, and she's back to share a little more of her story, what she's doing, where she's going. She's got a new website, which is extraordinary. And of course, my co-host, Dr. Mike, who has been a family member and really strong advocacy for RenéMarie's Language of Love. He has been really a mentor to me, really someone who has supported me, been there for me, always supported me, been on every single telethon we've ever done. So we're blessed to have Dr. Mike be the co-host. Hi, Dr. Mike.
Hi, Renee.
Dr. Mike, of course, this is Nicole and I were talking about this before because I don't know if everybody remembers last time we did the show, we were having problems with Facebook, that Facebook wasn't allowing us to stream live. So now we go through YouTube and we go on Facebook, and we were having technical difficulties, but we fought it and we went on. And Dr. Mike was having computer problems this morning. So he's streaming from his phone because nothing stops us in life to do what we got to do. So thank you, Dr. Mike. Thank you, Nicole, for joining us today.
Hello. Thank you so much for having me.
Oh my God, you're part of the family now. It's awesome. It's awesome. So Nicole, I'm going to let you start because, it's World Stroke Day, right? And how long ago did you suffer I'm going to put it this terms. How long ago did you experience a stroke?
So I experienced my stroke probably it's 7.5 years, almost 8 years.
Wow. And what was the date?
February 22nd, 2018.
Wow. February. So it's coming on. It's coming on.
It is coming on. Yeah, but I'm happy to be here. I'm happy to be alive. So
Yep. And that's the gift. I will tell you that, those that aren't able to walk or talk or continue to have reoccurring situations after the stroke, it's really, really sad, but we're all here to be their voices, to share what it feels like, because I think that's the thing that I always like to make sure that our audience understands how it feels to suffer a stroke, because it really does rip you apart. It does change your life. So how did having your experience in your stroke changed your life? Because I know it says it on your website, but I just want to give you the opportunity to share that with everybody.
Yeah, so having a stroke, I don't wish that on my worst enemy, because it really just tears your life apart. Not just me as like the stroke survivor, but also my family, my friends. It's it's really, how can I put it in like terms, but you don't know whether you're going to get everything back or none of it back, and you just have to live every day and just get like 1% better, or try to get better. Does that make sense?
Yeah, and you know what the truth is, and Dr. Mike can feed into this also. You really can't be hard on yourself. You um, have to be able to give yourself grace, because I know that when I've experienced, and I don't know for everybody, but I feel that if you're in a rush and you try to get things done, that hinders your ability to recover, because our brains, Dr. Mike, you could feed into this because you know better than anybody. When you suffer a stroke, it's like it's a brain attack, it's a brain trauma, right, Dr. Mike? So
No, it's
can
like
you
a heart. It's like a heart attack in the brain.
right, and that's how they try to experience to people. So Dr. Mike, I don't know if you could feed into this, but when you have a stroke, what happens to the brain? Do you know what happens to the brain?
Oh yes, basically you're getting brain damage, and just to start off, that the only reason why we're not as healthy as we should be is a combination of excesses and deficiencies, and we'll get into the problems that's causing people to have a stroke in this hour. In the next hour, we're going to go over things you can do to help prevent it.
Right.
What happens is that, well, basically and we were talking about this before the show, there's 60,000 miles of blood vessels in the human body. And that's a lot of miles. That's, going around the earth over two times, around the earth over two times.
Wow.
And what happens any point along the way, we can have a problem. You have, problems in the veins or the arteries or the capillaries. And that in the brain, you basically have two different types of stroke. We'll just go over that now. Strokes. You have one where the blood vessels are clogged or blocked, which is an ischemic stroke or an occlusive stroke. And that's about 80% of the strokes fall into that category. And then 20% is actually hemorrhagic stroke, where the blood vessel breaks and you're getting bleeding in the brain. So anytime this happens, you're going to get part of the brain that the blood vessel goes to that's affected either by hemorrhaging or being blocked. Those cells are going to die. So what
Right.
happens is that we have an innate intelligence in a body that's smarter than a supercomputer. And the body basically then rewires the brain as you recover to make up for the loss of function of the area of the brain that it occurred in.
I
And it
think
could be,
that's what happened to me, Dr. Mike, because from what I understand, because I don't have any medical experience, that I have four vessels in my brain. One of mine collapsed, and the other three had to reroute and do what that fourth one used to do.
okay, well, as far as the anatomy goes, what you have is you have vertebral arteries that go up through the spine that come together from the basilar artery. And then you have your carotid arteries that come up from the right and left side of the neck, and they all come together in what's called the circle of Willis, which is in the center of the brain. So it's amazing the way our brain is constructed in our body, that if you have blockages in all of those except one, it still gets that circle of Willis and feeds the entire brain. But one of
Right.
the problems when people go to the dentist or a hairdresser and they tip their head back, and or they look up at the sky like stargazing, that can pinch the vertebral arteries, and say if you have blockages in all your carotid arteries, but the vertebral arteries are okay, then you're pinching off and then you're cutting off the blood supply to the brain. So there are
Wow.
many ways a stroke can occur.
Wow. No, let's let Nicole share with us her little stroke story. I know you shared it on the show last time, but that feeds into what Dr. Mike was saying. There's two different forms of strokes. So what type of stroke did you have? And, you know, and I know your story, but our audience that's watching today may not.
Sounds good. Do you want me to get the whole shebang, or?
Well, just yes. I mean, yeah, just give us, you know, why, I mean, what caused your stroke, and you know, and we'll go into later on how you recovered from it, but what caused your stroke and what happened specifically that, you know, at that time. And you know, then I want to get into the next phase is, you know, time is of the essence when you suffer a stroke. So go ahead.
Absolutely. So, I had what's called an ischemic stroke, which is the blood clots in the brain. Um, I I was taking a nap, and all of a sudden I woke up and I couldn't move my right side of the body. I couldn't speak. And it was, yeah, the left side of the brain. It was um the middle, or middle cerebral artery is what I had as the blood clots. And so we got to the hospital.
Nicole, I want
They
to ask you something. Do you
Yes.
know, while we're on that subject, do you know what caused the blood clots? Do you know what caused the blood clots? What was the cause of the blood clots?
Yes. So I was taking estrogen birth control pill, and I also had an undiagnosed blood clotting disorder called factor 2, or prothrombin mutation.
Yep.
And together they formed clots in the brain. I believe it was 3 clots.
Wow. Wow. Well,
Um,
that's important because people know now when they do gonna take birth control that not that people shouldn't take birth control, but you should just work with your doctors to make sure that, you know, when you start to take it, be under medical supervision so that, you know, you can watch these things. Hang on one second, because I'm gonna ask Dr. Mike something because I think it's important in the conversation. Dr. Mike, if someone starts on birth control, is there any way to monitor the blood to to see whether clots are being
Well,
formed?
there's a blood test called the INR. Okay, the INR is the International Normalized Ratio, it's called, and it should be around 1. And normally it's between 0.8 and 1.1. Now, people go on blood thinners if they have a situation where the doctor puts them on blood thinners, it should be around between 2 and 3.5. But the problem with that is that you tend to bruise a lot more and hemorrhage. You have to keep it in that Goldilocks zone, that sweet zone. But
Yeah.
what happens is that people should get, and I suggest that people on their annual physicals, they should get their INR checked. There's a couple of different tests that they should have done on their annual physicals that are not normally done. And, the blood test, the INR is one of them. C-reactive protein is another one, which we'll get into later on, which is an indication of inflammation. And the vitamin D is very important to have done, which is not normally done with the annual blood tests. Uh,
Wow.
and vitamin D impacts about 1/3 of the whole genetic makeup.
Okay.
It's very important for injury repair. But that INR test is the one that shows how thick the blood is. That has to be monitored to answer your question.
So if they start just this, and we're not doctors. I mean, Dr. Mike is, but you know, we just want to give information to people so that they could form their own opinions and work with their doctors and medical group and team and family to make the proper decisions.
Right.
It's really important that Nicole is sharing today that, you know, because she went on my gosh, because she went on birth control and she had this other factor, which you don't know about this other factor, right, Nicole? You didn't know about it until after it happened.
yeah.
So okay, so you suffered a stroke and then they took you to the doctor. And I do want to share with everybody a little piece of information that you were an athlete, you know, and this happened during your swim meet, right? At your college, I believe it was
Yeah, it was my last swim meet.
last week.
Um,
And you were in competition and you were striving to be an Olympic, right? An Olympic swimmer.
No, no,
Ah,
I wasn't, but it was my last meet. I wanted to go out with a bang and like get my best times, while also my team, Bryant University, they were trying to win their first conference. Um,
ah, okay. Okay, so
and
they took you to the hospital.
they took me to the hospital, and I was in the best shape of my life. Like absolutely the best shape of
That's
my
why I
life.
brought up that you were an athlete
Yeah.
because like this, like I said initially, this doesn't discriminate. This
Oh,
doesn't discriminate.
absolutely not. It wasn't like I was doing something that was like not good per se. But yeah, they took me to the hospital. They gave me a medicine called the TPA, otherwise known as the a clot busting medicine.
Right.
Um, and actually, it's so funny. At the first hospital, when they were giving me the TPA, it was in a IV, and in the middle of the TPA, I actually was allergic to it.
Oh, wow.
Um,
Oh,
I started getting hives, so then um, they had to stop the TPA and get me to a more stroke specialty hospital close by to get the rest of the TPA with a lot of Benadryl and the next morning they did another CT scan as protocol and they discovered that my brain was now bleeding, which is a hemorrhagic conversion, and that is
So you didn't you didn't have a hemorrhagic. You had a hemorrhagic. Then it was a, what do you call it, Dr. Mike? When it's a blood.
the ischemic stroke first, and then it develops into hemorrhagic.
Wow,
You have
that's pretty
both because
intense.
the ischemic is 80%, hemorrhagic is about 20% of all strokes.
Wow, wow. So go ahead, Nicole.
yeah. So when they found out that it was hemorrhagic conversion, they told my parents like we have to go and like emergency surgery right away to save her life, and taking the left part of my skull flap and putting it in my abdomen to relieve pressure on the brain for about I guess 6 weeks. And they had said that 33% of my brain was dead. um, and the doctors had said that I would probably never be able to walk, talk, or use my dominant side arm again.
Wow. And look at you today. I had to bring that up. So, that's pretty, I believe that's the power of the mind and the will to want to not give up and the will to strive. And I believe that in your life you're setting yourself up for everything, and your personality and your drive and your ambition and your passion for life really does play a part when something like this comes into play. That's my own personal feeling, because if you weren't like that, if you were just someone who was, you know just going through life, it makes it harder because you don't have that it's almost like, when you're a pitcher, right, and you're throwing the ball, and it's just about the motion, it's just about to pitch it all the time, you have to do the same thing all the time, and it makes it where, you don't have to think anymore, you're just doing it, it's a repetitious. So
Yeah.
I think that your mental brain and everything just goes into effect. Dr. Mike, is there any science behind my thought patterns?
Yes, there is. Well, first of all, there was something I was going to talk more about the second hour, but since you brought it up, that attitude is very, very, very important. Having a
Yes.
positive attitude and not accepting the fact that something cannot happen and
Yep.
making it happen. And there's so much about human will driving us and doing the impossible. And, there've been plenty of cases where people have been, written off as never being able to recover, and they have. And a lot of it also has to do with faith and God and people praying for you.
Yep.
So statistically, that is unbelievable how many more people can recover when there's people that pray for them.
That's a show we have to do unto itself.
Right.
Absolutely.
Prayer, and we want to share that it doesn't matter what faith you are, right? It's just having good thoughts and thinking positive thoughts for that person. That's what prayer is. Prayer is just praying for somebody, is keeping positive thoughts and keeping them in your good thoughts and sending them good vibrations, right? I mean, I think that's the most important thing. So Dr. Mike, I know you want to say something, but I want to go back to Nicole for 1 second to share your family gets this information. And that what was going through and I wrote down family because I do want to do a show with your family, if they're
Yes,
willing to come on to
absolutely.
talk about how it feels. How does it feel when your loved one is going through a stroke? Because I specifically remember, and laying in the bed in the emergency room, my father was at the foot of his bed with his girlfriend at that time, and I could see that I couldn't speak, I couldn't do anything, but for some reason God let me see the look on his face, and the look on his face was devastating. It was devastating. So talk into a little bit about that.
I mean, yeah, for the first like week or so, I was out of it. I was on so many medications that I really don't remember it, but when I talk about it with my parents, they just were so, again, devastated, just like, why did this happen to you when you were in the best shape of your life? Um and I feel like there was just like a why did this happen?
Yep, yep,
Um,
yep.
and my mom and my dad always are like, why couldn't this happen to me? Why did this happen to my daughter?
Yep, yep.
And it's it's
It's
it's
hard. It's
hard. It's
hard.
definitely hard.
And I think that, and you'll probably confirm this, Nicole, I think it's harder on them than it is on you. Because yes, you're going through it. You have no choice. You're
Exactly.
going through it. You're fighting, you're battling your life, you're fighting for your life from the inside. And here these family members that can't do anything but send you love and prayers and positive thoughts and just be there for you. There's nothing they could do. So if it's not as harder, it is as hard as that person going through it.
I think that is spot on because yeah, they can't do anything. And um one of so my dad he said like I'm supposed to be your Superman
Yeah.
and I can't be that anymore. And I said, "Oh, yes you can, but he is feeling that as, he can't take away what has happened to me, if that makes sense."
Yeah, yeah, yes, yes. Yeah.
But I also feel like, you know, God has a plan, God, or if you want to say like higher power, um, I I go back and forth in saying like, like, oh, everything happens for a reason. I'm like, does it happen for a reason? Does it not happen for a reason? I feel like it does. And I feel
It
like
has to.
God gives his strongest, or no, God gives his strongest battles to his strongest warriors.
Yep, yep. Because he only gives you what you can handle.
Exactly. And it's we got this.
Yep, yep, yep. I see you wearing your American Stroke Association
Oh,
shirt.
yeah, no, I actually was I think it was 2 days ago. I had gone and did like a presentation, not a presentation, but just like said my story for the American Stroke Association because they're doing a oh my goodness. and it's again the aphasia.
I know. I
The
still do it, so don't worry about it.
the Cycle Nation, which is a American Stroke Association, American Heart Association's fundraiser for strokes.
Okay. Yes, yes. And I actually went down to Trenton with them, and I went to Washington, D.C. with them. If you have the possibility to go to be an advocate, do it, because it's incredible. It's incredible to go with that. And you meet so many stroke survivors and advocates, and it was an experience, two experiences that just were awesome. I don't know who was your connection there. I know that not Connie, Corinne, Corinne, Corinne is one of the advocates for down in Trenton.
Oh, that's great.
I think that's her name. I'll send you her information. She goes into the logistics with into the legislation. So she's wonderful. Dr. Mike, I'm looking at the American Stroke Association website, and it says strokes can happen to anyone at any age. We believe that. We said that. Globally, 1 in 4 adults over the age of 25 will have a stroke in their lifetime. Most adults in the United States don't have fast warning signs of a stroke. Oh, I didn't know that. Most of the adults in the United States don't have fast warning signs in their stroke. Stroke is largely treatable if you call 911 as soon as you recognize the symptoms. Feed into that, Dr. Mike. Globally, about 1 in 4 adults over the age of 25 will have a stroke in their lifetime. You were saying that younger people are suffering from strokes.
Well, globally, as far as causes of death, number 1 is heart disease, number 2 is stroke. But in the United States, number 1 is heart disease, number 2 is cancer, number 3 is stroke.
Okay.
The States is a much higher level of cancer, but globally, and when you talk about cardiovascular disease, you're talking about stroke and heart attack both, because that's all part of the whole cardiovascular system. So, and we're talking before about 60,000 miles of blood vessels, and there's a lot of miles there where something can go wrong.
Right. Yeah.
As far as it's a good time, I guess, to go over Be Fast.
Yeah. Yeah.
So, and one thing with Be Fast though is that what they're really missing with this is headache, which I'm kind of surprised that is not included there, because a severe headache can also be another indication of a stroke.
I just want to stop you for 1 second, Dr. Mike, because FAST is on the American Stroke Association. And I know why, but why did they change it to Be Fast? Because it is now Be Fast. It's not just fast.
Right. Because B for balance. Because one of the first things, you're stumbling around, you're losing your balance. And what Nicole was talking about before, about the one side of the brain and the other side of the body, because when you have a stroke on one side of the brain, it affects the opposite side of the body. And so if you're having a stroke on the right side of your brain, it might affect the balance on your left side of your body. But in general, balance is off. Eyes is the B. Eyes and the E is for eyes. Now with eyes, you can't raise your eyebrows, you're losing focus, you're having a problem with your eyes. Then that's what was added to it. And the fast is face. With the face, you're drooping, you can't smile, you got numbness or tingling in your face. Those are all indications of the possibility of a stroke. A for arms. You get weakness in your arms, or you can't pick up an arm, or numbness in an arm. And also, if you got numbness on your left side of your left arm, could be a heart attack too. And then S is for speech. You're slurring your words, you sound like you're drunk, you can't talk at all, speech. And T is time, because time is of the essence, and to try to get help as soon as possible. Now, one thing that was said a long time ago, I just want to go over this because there was a lot of controversy about this, and there still really is, that some people say you should take an aspirin. You've heard that before, right?
Yes, yes, yes.
Now, they say that if you take an aspirin and you're having an occlusive, an ischemic stroke, it could help. But a hemorrhagic stroke is going to make it worse, because it's going to thin your blood and make you bleed more.
Right.
But I'm a person that likes probability. And since 80% of the strokes would be the one with the blood clot blocking, you're better off. But if you're one of the 20%, it could kill you, an aspirin. So, life is a bunch of gambles. So I couldn't tell you to take an aspirin or not take an aspirin, but there's still a lot of controversy about that. And I can't even tell you that anyway, because I'm a chiropractor and aspirin's a drug. So I'm not allowed to tell people to take or not take drugs. But, everything's a risk. Every time you cross the street, you could be hit by a car and killed. Doesn't mean we never cross the street. We just take precautions.
Right, right, right. Well, I mean, I'm recommended by my doctor to take an aspirin since I was the age of 26 and I suffered my stroke, because I didn't want to go on blood thinners at the age of 26, because I believe, and this isn't medical, I believe that when you take medicines, it changes your whole body. And I didn't want to, I try to limit myself to any medicine I have to take. That
Right.
being said, I recently had to go on high blood pressure medicine because my throat was bothering me. I went to the the Medi clinic to see, because I'm always very careful about my health, because my granddaughter has a seizure condition, which she's just been diagnosed with autism as well, but her body runs on illnesses, what's it called, her immune system. So she suffered, when everything comes up in her body, it always triggers a seizure. So I went to the I don't know if I told you this, Dr. Mike, it was a few months ago. I went to the Medi clinic, and my blood pressure was 180 over 101. And I said, okay. And we were trying to figure it out, myself and that doctor in there, what it was. And maybe it was because I had strep throat, or, all that kind of stuff. And then I took the medicine. I came home and I laid in bed and I said, I can't ignore it. I can't ignore it. I suffered a stroke, at 26. I can't sit here and have high blood pressure, even if it's from my strep throat, because I don't want to suffer another stroke. So I called my daughter. She took me to the hospital, and they couldn't get it down. So they had to give me high blood pressure, and my blood pressure had been a little bit high over the course of it was on that borderline. And my doctor and I were monitoring it very closely, but it wasn't 180 over 101. So they put me on high blood pressure, and I've been on that ever since. That being said, Dr. Mike, high blood pressure plays a huge risk of strokes. Am I correct?
Absolutely correct. That was the number one on my list. And we
Yeah.
can get into the causes now and risk factors. But one thing that's very controversial to another controversial thing in medicine, because things have changed so much. Eat eggs, don't eat eggs. And now a lot of cardiologists are getting away from the polyunsaturated fats because it causes a lot of inflammation. But that's a story for another day. But rapid heart rate too, besides high blood pressure, having a rapid pulse, because 120 over 80 traditionally is supposed to be the ideal Goldilocks zone for blood pressure, even though some people say 110 over 70 now. But
110 over 70, that should be your high blood pressure.
now 120 over 80 is traditionally what was considered normal blood pressure.
Okay.
With heart rate 72 beats a minute. So if you have a rapid heart rate, and if it gets over like 100 a minute, they call it tachycardia. If you get too high, it's a risk factor. Then tobacco use, another huge one. And a lot of people are not smoking like they used to, but the vaping is just as bad. I think it's even worse than cigarette smoking, because the nanoparticles, little tiny metal particles that can go deep into the lungs, as well as they put antifreeze in a lot of these vaping,
Oh my gosh.
And New Jersey was the first state in the union in the United States that deemed vaping exactly the same as cigarette smoking. So wherever you can't smoke, you can't vape in New Jersey.
Okay, that's good. I just want, go ahead. No, go ahead. What were you going to say?
Alcohol consumption is next.
Okay.
And plus that messes up your liver, does a lot of things. And now, in the last year, they're saying a drink a day. They used to say, just like I said with medicine, they keep on changing things. That's why they call it the practice of medicine, because everybody knew what they're doing, won't be practicing.
Yeah.
But the like a drink a day, like a glass of red wine a day, because there was resveratrol. But now they're saying a glass of wine a day can greatly increase your chances of cancer. That's within the last year that's really come
Oh,
out.
yeah, yeah. And I used to hear, my grandfather used to have red wine on his table. And I used to hear like a glass of red wine a day could thin your blood, just like taking an aspirin. And it is medically, approved, a glass of
Right,
red wine a day.
right. We're going back to the aspirin. I'm glad you mentioned that because I was thinking that before. It's a baby aspirin,
Right, a baby aspirin.
a baby,
Yes.
right?
Yeah. Yeah.
But what I was saying before about I was talking about taking a baby aspirin a day to prevent a stroke. I was talking about when you have the symptoms of a stroke, whether or not to take an aspirin. That's what I was talking about before with the controversy about that.
I will go back, and I can only say this because it was on my show. A nurse was on my show when I was doing it out of Long Island live, and she came on my show and she said that if you're think you're having a stroke, you should take 3 aspirin, and while you're before you go to the hospital, so
Well,
that you could prevent, you're kind of like putting blood thinner in your body so that you could prevent a little bit of a stroke.
well,
I don't know that to be true. And
well,
I'm not saying it. I'm just repeating what she had said.
right, but that's very good 80% of the time, very bad 20% of the time.
Right, right.
Because if
And
it's
you don't know which one.
right. So that's why, like I said before, if you're a gambling person, but you know, 80-20 is a pretty good odds. But if
Yeah.
you're the 20, it's just like anything. If there's a 99% chance of something not happening, you could be the 1%. So
Yeah, yeah,
you know,
yeah,
life is a giant risk. Next is EMF exposure. Okay, exposure to Wi-Fi, to cell phone, to cell towers, 5G. All of that is very, uh, just for your health in general, and it could cause an increased chance of a stroke.
wow,
Toxic overload. Just we're exposed to so many toxins. There's about 60,000, toxins that we're exposed to a day. Chemicals that were never in the Earth's crust. So, genetically, our body can deal with stuff that occurs in nature, but things that are man-made that don't occur in nature, we have a hard time eliminating. And that's one of the things that, without getting political now, but that's one of the things that uh, Kennedy is trying to do with the United States to try to mimic what Europe has done, as far as Europe allows much less, toxic chemicals in their cosmetics and their food supply than we do.
yeah,
And
yeah,
there's a big influence that big agriculture and big, you know, the pharmaceutical companies have on the politicians. But like I said, we won't get into all that now. The next, which is very important, if you have heart disease, because if you have heart disease, you're more susceptible to a stroke because of something going on with your cardiovascular system. And I mentioned before about that CRP, that's C-reactive protein. That's the test that you should have done every year for chronic inflammation.
Hmm.
Now, chronic inflammation is related to stroke a lot more than cholesterol is, because when you have the high inflammation, that makes the cholesterol bind to the walls and create the sludge on the blood vessels. But cholesterol is essential because most of our brain is made of cholesterol, and we need cholesterol for our hormones.
right, right,
So
right,
so if you have sky high cholesterol, it's not good. But they find everybody that reaches 100 years old, there's nobody there with low cholesterol.
right, right,
So
right,
that's,
right,
again, another very controversial thing. But triglycerides are not that controversial. If you have high triglycerides, that's not good. Lower triglycerides are much better. It should be around 50 to 150. And your total cholesterol should be under 200, they say. But the HDLs are the good cholesterol, and the LDLs and the VLDLs are the bad cholesterol.
Dr. Mike, I want to stop you there because you spool out so much
I know.
information.
I know.
No, doesn't he? Like, it just
I
blows
know.
me away, all the information he's gotten. That's why we're doing the show, to inform people. But I just want them, if you could just hold on to the rest of the list. I don't know how many more you have.
A good number, but not that many.
Okay, all right. So let's let everybody digest what you said, and let Nicole feed into the story a little bit, where we were with your parents and them, talking about your stroke and the doctor saying that, you didn't have any chance for recovery. And so take us from there, because all of what Dr. Mike is saying is preventive, is informing us of ways to stay healthy. But here you were in a situation and you lived a healthy life. You were not one to party or to go out and and do crazy things. And here, like your father said, you were suffering stroke. Why? So feed into that a little bit.
Yeah, so it was birth control and a non-diagnosed blood clotting disorder, and it was very surprising because a lot a lot of people were taking birth control pills, and it was fine. I
I will tell you that someone that I know, and I don't want to get into specifics because I don't want to give personal information out, but I know that they had suffered blood clots from birth control. So it doesn't only happen to you; it happens to many, 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 many people. Maybe we'll do a show on, the effect of birth control. Maybe
oh,
we'll do a show on that so that we can,
absolutely.
yeah. Okay.
Um, but yeah, no, so many girls are on birth control pills, nothing of the out of the ordinary. And then to find out that I have a blood clotting disorder that I didn't know about, it really um that's why I always like self-advocacy, because self-advocacy is so important. Um but so they deemed it a stroke, and so from then on it was just about me getting back to as normal, or at least I thought that I would be back to normal, and normal is not, it's what's it what it
Nor that's it's a
it's
really
a
a different terminology. Normal.
exactly, yeah, no, what
What
is
is
normal?
normal? That's
What
what
is
you have to
normal
ask.
is up to your interpretation, but like for my normal.
Right, right.
Um,
But the truth is, we aren't the same, even as we grow and we age.
absolutely not. Yeah.
So there is no normal. There is no normal. I
No.
think just going down, we have a two roads, paths in the road, and which one are we going to take? Are we going to take the one that just keeps us there, or are we going to take the one to strive to get better?
Exactly. Yes. So I strove to get better, and I I loved.
Nicole, I want to ask you something. I'm sorry to bother you,
That's
but
okay.
what was, could you think, were you able, if you put yourself back in that place, were you able to remember wanting to get better, or like, was it just an inner fight?
Great question. I
And you
I
probably may not be able to answer it. I'm just asking.
yeah, I don't think I could answer that really deep down. I know that as I got more like conscious, like, I wasn't in that blackout zone. Um I wanted to get better in part for me because I'm a stubborn, competitive person. Uh, and I'm a perfectionist at its best. But also
Which plays a
just
positive thing, which
what'd you say?
which which is a positive aspect of why you're where you are.
Absolutely. I feel like um the per the perfectionism, and then also the like athletic like mindset, and the positive mindset, I think it like together it really transformed.
Well, we as athletes understand striving. We
Mhm.
understand we understand focus. We understand competitiveness. We
Oh,
understand we
absolutely.
understand failure. And what are you going to do when you lose? You go back and you do it 20 times harder. So there is no stopping us. We just take a step back and we're like, what are we going to do? We lost that because what did we do wrong when we lost that? What are we going to do now?
Exactly. And I have to give credit where credit's due. So, when I got out of the hospital and I was moved into an inpatient facility, Kessler in Saddlebrook,
Yeah.
one of the EMTs on our way down to Saddlebrook, she was like, never let anyone tell you what you can and cannot do.
Yep.
Prove them
Yep.
wrong.
Yep.
And it stuck with me
Yep.
the entire inpatient. I mean, it still sticks with me today.
You should really note that. That should be a PowerPoint of yours. That should be
Oh,
because that ride was an important moment in your life. That ride from the hospital to Kessler. What happened? What transformed you in that moment? Those words that nurse or that paramedic said to you. That's really what stuck with you.
and also credit where credit's due. My in one of my inpatient occupational therapists, she taught me about the power of yet,
Yep.
and that blew my mind.
Yep. Yep.
Because yet is one of the most important words out there because it just means for right now.
Right.
But I mean, it's a key part of the growth mindset, believing that the abilities can be developed through not growth, effort, learning, and persistence.
Yeah.
And combine that, I still am also doing the power of yet right now. Like I
Yeah.
can't run yet. I can't use my fingers yet.
Yeah.
And that just really opened up the world for me because it doesn't mean that I can't do it forever, but it just means that I can't do it right now. Does
Yeah.
that make sense?
Yeah, absolutely. And that's all the mindset. That's all the mindset that when you say no, I can't do it, you're never going to be able to do it. When you say I can't do it yet, it's different. I'm striving, I'm working, but it's not my wheelhouse right now, but I will be able to do it. That's why I have a dear friend of mine who I communicated with. I guess I could say it because I'm not going to say his name right now, but he's suffering from cancer, and he is the most powerful mindset, positive mindset. He does not let any negativity into his wheelhouse. And that's how I used to be until my mentor, my mentor, my confidant, Dominic Cordelessa, said, okay, this is the way you are. But if you want people to be able to understand you and to be able to communicate with you, you got to come down and you have to open up and you have to be able to listen and share. So, so now I know how to navigate that. Like, I don't let anybody into my positive mindset, and neither does this person. But I, as being an advocate, have to listen to people, and I have to be able to share with people. I have to be able to understand their ways of thinking. So I totally get we're going to let Dr. Mike share a little bit more on his information, so
Well,
that we could think about what Nicole had said about the yet. We're going to do a show on yet. You're going to come to my house and we're going to do like a live show, you and I.
Absolutely.
Yep. Go ahead, Dr. Mike.
okay,
Feed us some more information.
okay, but I'll try to be faster now, not dwell because I still have a lot of things to go over.
That's okay. We have the second show as well. We have
Okay.
a whole another hour, you and me.
Okay, the next is homocysteine. It's an amino acid, and if you have there's a genetic mutation, and everybody should get checked for all these genetic mutations because the technology is out there and it's not that expensive now. Because Nicole, if you were tested prior to taking the birth control pills and you found out that you had this genetic anomaly, then it would be contraindicated to take the pills. But you didn't know until afterwards. So,
But Dr. Mike, I have a question for you on that, because sometimes doctors don't communicate, right? So if her main doctor, her gynecologist, who I'm assuming prescribed the birth control, didn't communicate with her medical doctor who takes the annual tests, right? If they don't communicate and they're not in the system together, how do, I guess she would have to be the one to bring the information to the other doctors so that they're fully aware, right? Because it's all about
Right.
information that the doctors have.
Because
Talk to us a little bit about
you have
that.
to get tested for these things, but there are these wide genetic panels where they test like a couple hundred things genetically, and they're relatively expensive now. And there's a number of companies that are doing this now, and you can just find them and see what works into your, budget.
Right.
But homocysteine is this called the MTHFR mutation, and basically what happens is you can't methylate B vitamins. There's two different forms of B vitamins. There's ones that are, regular, and then the body methylates them, but you can't do that. It's a lack of methylation gene. So what I suggest to everybody is to get your homocysteine checked one time, and if it's high, then get the genetic test done. If it's not high, then you don't have to worry about it. But it's not something you have to do every year, unless, of course, you have that mutation, then you want to monitor it.
Right.
Poor circulation is very important for, as a risk factor. Poor oral health. Now, the last couple of years, a lot has come out about gingivitis, gum infections, poor oral health, and cardiovascular disease, both stroke and heart attack, because it greatly increases inflammation through the whole body. You could do a whole show on that. I actually went to a program. Maybe you want to get a biological dentist on and talk about that, because it's very much related to, to stroke and heart disease. Next is fast food and ultra processed food and a poor diet. Horrible. You have to start eating all the colors of the rainbow. Eat fruits and vegetables, the red, orange, green, yellow, blue, indigo, violet, and grass-fed beef, not processed, with all the hormones and everything.
And I believe that, Dr. Mike, because we're whatever, like the medicine I don't want to put in my body, right?
Yeah.
Ingesting food as well. So medicine and food, whatever you're putting in your body really does play a factor into your makeup.
Right. Let food be thy medicine, and medicine be thy food.
Yeah.
Ancient Greek. Stress and cortisol release. That has to do with attitude also. Having a positive attitude and reducing stress. During COVID, I used to tell my patients, being scared of the virus throws out the welcome mat and allows them in, because it plummets your immunity.
Yeah.
Again, to mention the lack of faith in God, and whether or not you believe in God, it's up to you. But I do.
Yeah, and I do too. But whether it's higher power, like Nicole says, what I always try to tell people is, I don't know if you have faith, but please don't wait until something happens to you to start to pray.
Right.
Because honestly, it's like a friendship, right? And I don't care if it's the higher power, whoever you want to believe in, whatever is your best, connection to God or to the higher power, whatever. Start a relationship now. Make sure you go in. Make sure you take time. As busy as I am, I do take time to be alone. And I don't care if it's in the car when I'm yelling. This is the only place I yell and scream, in the car, because nobody can videotape me. Nobody can hear me. No. Remember that, Nicole, if you ever want to get a little bit angry, because there's videos around everywhere, and people don't understand why. You got to get your emotions out. But now people are going to be videotaping me in the car, but they won't be able to hear me anyway. So my point is that you do have to start a relationship with something, because something major and traumatic is going to happen to every single one of us throughout our lives.
Right.
Our lives. And you don't know when that's going to happen. So make sure and be kind to other people. I know that plays a big part of it. When you're praying for other people, you're keeping people in your good thoughts, it always comes back to you. It always comes back to you.
And along with that too, don't hang out with negative people.
Yeah.
Because you have to cut them off, because negative thoughts and negative vibes can do harm, just like positive thoughts and positive vibes can do good.
Yeah, but sometimes you have to work with them. So you
Of course,
have to
right.
just, but sometimes you have to cleverly find a way to block them out or move your desk or no matter what you got to do to not be as intertwined with them as possible. Maybe you're put in that position to share positivity with that person. Maybe you're put in that. So, give it to them, share the positivities, then walk away, get out, switch the conversation, so.
And just from before, you talk about with faith, remember there's no atheist in the foxhole. That's an old joke, because when people are shooting at you, then all of a sudden you're embracing God. So it shouldn't take that, though, to make you go in that direction. It shouldn't take
Yeah.
catastrophe.
Yeah.
Okay, AFib is very important too. If somebody's got AFib, irregular heartbeat, that could be, an indication of an increased probability of a stroke. And deep venous thrombosis, blood clots in your legs, that is also, which usually breaks off and goes to your lungs. Doesn't go to your brain directly from the legs. Diabetes, another huge risk with increased blood sugar, and that's why that should get tested every year. Hemoglobin A1C is another test that should be done, which is not your spot glucose. The spot glucose is how much glucose is in your blood, but the A1C is how much glucose is in your blood over a period of time, which is a better indication of what's going on. Chronic kidney disease also is an increased probability of stroke. Cancer, autoimmune diseases, being overweight, lack of exercise, and a sedentary lifestyle. And the problem now, especially with kids, you remember when you were a kid, you used to, even though Nicole's younger than us, but even when she was a kid, it's not like now. There's so many of these kids, they just get in front of the screen. That's all they do. They don't get exercise, which is horrible. And so they're laying the foundation for increased probability of premature death by not being active in an early age.
That's why I want to bring something to the attention. That's why the first thing they do for budgeting factors in the high school is cancel freshman softball or freshman soccer. It's not healthy for kids
Right.
because they have to be able to. School is a really important aspect of our lives that kind of leads us into learning what we're there to be, and friendship and team playing is really an important part of life. It
Right.
really is an important part of life. Dr. Mike, I'm going to let Nicole share in a little bit because we're almost at 10 o'clock. And then you and I can continue, but I'll let you finish your list in this show. But I want to go back to Nicole to share, like, your family was such an important part of your life, your recovery. And so were these other people at Kessler, and that woman in the ambulance from the hospital to that. What part did, like, the prayers and the connection and the good thoughts and the positivity and all that play to this day? What is that? How does that affect you? And what do you do when somebody negative like Dr. Mike comes into your life? Like Dr. Mike had shared, like, to get them out. So what do you do about that?
So I mean, it still plays a part in my life to this day. I feel like I am a pretty positive person, and um I don't really think that people who are negative, they kind of just like stay out of my way, if that
I
makes
go I
sense.
go around them.
Yeah.
I let them, we talked about that in the last show. I let them stand in front of me, chattering, and I'm like, physically, mentally, I'm like around them and moving on. So I get it.
Absolutely. Oh, absolutely. Yeah. And I mean, I I am coaching a swim team, and some of the kids are sometimes they're negative, and I'm just like, but but do you see that? Like, and I try to explain, but what about the positive, or what about, like an alternate way? And sometimes they're like, oh, I didn't really think about it like that. Or, and then if they want to be negative, I can't change their mind. So I'm just like, okay, well, I wouldn't, I don't know, do that, or, think that, but, you're your own,
Person.
person. Yeah.
Yep, yep. And then you know what? Just feed them little pieces of information, Nicole. Just feed them
And
little pieces of information. Because the truth is, we can't change anybody, but we could be the example and the inspiration for them. You know,
we, my psychologist, she's always like, oh, I'm just, what's her saying? I'm just, feeding you breadcrumbs. I'm
yeah,
just feeding you breadcrumbs. Um, and it's like, okay, like, maybe I can't, see it just yet, or maybe I'm just like so focused on whatever. But then, like, as our sessions go by, I'm just like, oh yeah,
yeah,
that's right.
yeah, 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 yeah. Just and the other thing is, I don't know if you keep a journal. If you, you could do voice messages and stuff.
I was just gonna say
Yeah,
yes.
yeah, just so you can remember everything. Because you can tie this all into another book, or and your life is such an important part of the world, your story. And you're an inspirational person, and you're very positive, which is a great thing. So the world is lucky to have you in it, still in it. So
And you as well.
thank you, thank you. So Nicole, we're running a little bit over. Is that okay?
It's okay.
Okay, so Dr. Mike, you could share the rest of your important information for us?
Okay, I'll try to do it quickly.
It
Uh,
doesn't matter, because whatever time, we can always do the shorter show, the second one.
okay, medications. And you talked before about birth control pills. It's one of them. Hormone therapies too. As far as blood thinners, if people on blood thinners could increase the chance of a hemorrhagic stroke if that INR is not in that sweet spot, like I talked about before. Also, illegal drugs like cocaine, opioids, and also stimulants, including even excessive caffeine, can increase your chances of a stroke. Age is important because the older we get, the more probability of a stroke can occur, but it can occur at any age, as well as family history, because of, a lot of times genetic predispositions to strokes run in families. Gender is important because women are slightly less probable to have a stroke, but when they're older, their strokes can be actually more deadly
Hmm.
in old age than men, which was interesting. Race is important too because blacks and Hispanics have a higher probability of strokes than other of the races. And, along with sickle cell anemia, any blacks that have sickle cell anemia increase the chance of stroke. Patent foramen ovale, PFO, it's a small hole in the heart that can be diagnosed uh, sometimes after it actually occurs, stroke occurs, at the upper chambers of the heart that can increase your probability. And this is an interesting one: migraine with an aura. And
With an aura.
with an aura, in other words, a migraine with an aura means that you see like lights and stuff when you.
Yeah, yeah, I know what an aura is. I never heard that when you have migraines, you also have an aura.
Well, no, you can see an aura. Some migraines have an aura, some do not. So when you have a migraine with an aura, even with younger adults, and which occur more in women, can increase your chances of having a stroke. And pregnancy complications, including preeclampsia, gestational diabetes, postpartum clotting, also increase probability of stroke. It's an interesting one here: iron overload. And there's something that's called ferroptosis. And a lot of research has been done on this lately because the red blood cells can become fragile.
Oh,
And when they break prematurely, it releases iron into the system, and it can lead to fatty liver disease and increase your chances of having a stroke. So you should have your serum. Another test that should be done is your serum ferritin, which is an indication it's not the iron in your blood, but your storage of iron in your body.
wow.
That should be lower than 100 nanograms per milliliter. Now, a nanogram is a very small amount. It's 10 to the negative ninth. It's a 1/1 billionth of a gram is a nanogram. So less than 100 per milliliter of blood, and ideally should be between 35 and 45 nanograms per milliliter. And if you have a high ferritin, the best thing to do is donate blood up to every 3 months, and it could reduce your ferritin levels. And that's the end of the list.
Wow. Well, that's, all that information is really important because it gives a variety of different aspects that could cause a stroke,
Right.
and so my question to you, Dr. Mike, is how I know we should have blood tests, but how do we know? I know you said like in each one you should have that test in your blood, but when we go to the doctors, how do we find that out? Like, like, we trust our doctors to know what tests have to take for
Right.
us.
Well, you have to be your own advocate. Like Nicole was saying before, you have to do that. You have to look out for yourself. And part of that is doing research. And I mean, luckily, I've done the research for a lot of my patients. I can recommend for them what to include. But the things that are not included in the standard blood tests I went over before
Yeah.
should be included. Like I said, homocysteine only once in your lifetime to find out. And then you get the genetic test done for that variation, for the MTHFR, the a gene that can't methylate B vitamins. And then you should have the C-reactive protein, CRP, done every blood test. You should have your vitamin D done every blood test. You should have your hemoglobin A1C for your chronic sugar level done every blood test. And I think there was one other one too I mentioned that should be done also.
I have a question while you're thinking of it. Do those request costs included your insurance?
Well, that's an interesting point because annual blood tests in the state of New Jersey are included for free with all insurance companies. Okay, there's for your physical, there's no copay, there's no coinsurance, there's no fee. It's
I have to pay. I always get an amount that I have to pay from what's it, Quest or whatever. I
right,
always get like an added, like, I guess what the insurance didn't cover.
right. I was getting to that. The reason why is because you probably have additional things above and beyond the normal panel, and
Right.
that could go towards your, payable amount. So those are all very important to, have done on an annual basis. But the genetic testing too should be done, once in a lifetime. You have to get that done all the time, unless there's new genetic tests that come out that weren't done on you that you can get done. And more are coming out every year.
So we have to, Dr. Mike and I, we need to get together. You need to share with me you probably shared it in the past, but I want a list of those tests that need to be taken
Right.
because we need to have someone on the call that could share with us why we have to pay for it. If they're gonna prevent
Yeah.
us from having a stroke, why we have to pay for them. We have to ask an insurance company. We have to ask a congressman or a senator or whoever we need to ask. Because when I was in Long Island, Judy was very good at getting. Nicole, do you have to go, or you can hang out with us?
Yep.
But we'll just keep going if that's okay. We'll just Judy was very good at getting a senator. Or a congressman, and they would sit there and share with me. And we had this one guy, I'm forgetting his name. He was he led the health in New York State for the state of and he could give me information of why, how, all that kind of stuff. And it's really important. So we have to do that in New Jersey. We have to find that person that could help answer the question and get them to include them in our annual test, because there should be no reason why we should suffer a stroke or why it should cost us more money when it's to our benefit. You agree with that, Nicole?
Oh, absolutely. Yes. No, I have been like going over articles about like, oh, well, you know, the thrombosis test is too expensive. Well, if I had the thrombosis test, then or one of the many, I guess, then I wouldn't have had a stroke, and then insurances wouldn't have to pay. I think my grand total for getting my skull removed and putting it back on was like $2 million.
Right. And they would have, so that the couple $100 that they would have paid or whatever would have, yeah, I get it. I get it. It just like it flabbergasts me. It flabbergasts me.
I totally agree. It's a really a disgrace.
Yep.
It's a really disgrace.
Well, we coming face with it today and talking about it. Okay, we could just leave it there, or we could get together.
Yep.
And start the parade. And actually, I'll talk to Corinne is her name. I think is her name. Corinne from the American Stroke Association. Let's get together with her. I think she still works for them. She's in legislation. Let's talk to her about how we can make this work. She's probably got all the dots, you know, dotted and the T's crossed. Dr. Mike, what do you think?
The last one was ferritin, the one I mentioned before that I didn't put on the list at the end.
Ferritin. Just send me the list, okay, so that we could do that. We're going to continue on. We're not even going to break, if that's okay. Nicole, you were good till 11 o'clock?
I actually have to leave at 10:30.
Okay.
Is that okay?
Yeah. So let's cut out then. Let's take a couple minutes to cut the show. And then Dr. Mike and I will stream back on and just make it easier for the streaming from the broadcast we're on. I'm drawing a blank. Anyway, so yeah. So Nicole, give us like your vision for the future for stroke patients, for stroke advocacy. Give us that vision. Give us where are you taking this? It's World Stroke Day on the 29th. What are you going to be doing that day? What are you going to be saying to people?
I want to say it's all about one, self advocacy, and two, I mean, insurance companies and everything. But no, I really want to take the advocacy and just amp it up with going to senators, or I absolutely love I'm a motivational speaker, and I love the part of my speaking where I say like, why did I have a stroke, and this, that, and the other thing, and like people are flabbergasted on like why I had the stroke. A lot. I talk to high school students, I talk to college students, I talk to companies, and they or friend or a daughter is taking birth control and they don't know about this blood clotting disorder, or that blood clotting disorders can increase the likelihood of them having a stroke or them having a DVT, or and I just want to put that again, like kind of giving them a little bit of like a breadcrumbs into being like, maybe we should ask doctors to see if they can get the test. Or I know that 23andMe, I believe, has a genetic
panel
component to it, right?
Yes, the 23andMe and Ancestry.com does. There are a whole bunch of them now that have these genetic panels, and just in recent years, because it wasn't, available that much in the past until recent years. But also, part of what's called standard of care is that, in my opinion, I think it would be a form of malpractice at this point for a medical doctor to prescribe a birth control pill to a patient without having them tested first to see if they have the genetic predisposition to blood clotting disorders.
So we're gonna work on that, Nicole. We're gonna work
Yeah,
on it together.
please.
Yeah,
Yes, that would
yeah,
be
yeah.
a beautiful thing.
Because you're an example of it. Like I could talk about it, but it never happened to me. But you're an example of look what happens when you don't get tested. Look what
And I
happens.
and I have a friend who she is also a stroke survivor, and she was on birth control, and she has factor 5, which is a blood clotting disorder as well, and she didn't know about it until she had the stroke.
Yeah, yeah. Well, this conversation has not ended. It's only begun. Let me just write that down. Factor 5 so that I could keep notes. But we're so lucky to have connected with you, Nicole. You are an inspiration. You're doing great work. You're doing wonderful things for the stroke world, and especially on World Stroke Day. It really is important to get the message out, and we're just happy that you joined us today.
Thank you so much. It was a pleasure, and thank you so much for having me.
Oh my God, yes, yes, yes. We wouldn't, yeah, you'll be on again. We're gonna get together though on the stroke panel, the panels. We're gonna get together. I'm gonna start a conversation with Corinne. But Dr. Mike and I will be back in a few minutes. Dr. Mike has a flood of information. And he really provides us with information that's really important. And like we said, like each stroke is so different. And you have to have that information to be able to take to your doctors and talk to your doctors about it. It's not like we're giving you information that needs to be done. We just want you to have all the options in front of us. And that's the name of our next show, Alternative Options, which is Dr. Mike is going to provide more information on what we need to do to prevent strokes and once you have a stroke, but he's also going to provide us with alternate observations. Oh my gosh, I can't even think today. Alternate alternate options. And before we go, I want to bring to light that it was Stroke Warrior Radio that we broadcast on. Ralph does a great job. Ralph was a stroke survivor. He has been a co-host on the show many times, and we're booking him again to be a co-host. He started Stroke Warrior Radio. He just celebrated 10 years after a stroke. He's a great guy, a big advocate. So we can't wait to talk to him again. But an important information. So on 3, we always blow kisses. Dr. Mike and I will be back in a few minutes. Here we go. 1, 2, 3. Bye, everybody. See you in a few. See you in a few. Oh, let me just say no.